everyone. As you all know by now, my name is Tamara Terraza, and I want to start off by saying how excited I am to be here today. To be quite honest with all of you, I am a little nervous. I have never spoken at a conference, and especially a conference this big, so I want to apologize in advance if I stumble on some words. But Tammy and I will just be discussing three main topics today in our presentation. So the first is I'm going to share with all of you a piece of my life, my own story. And second, Tammy and I will discuss the history of my voice and how my voice works. And the third thing is we will talk about specific data we've retrieved through my voice and through surrounding reproductive health. So I want you guys to all try to imagine this. I used to wake up early in the mornings and look out my window and wait for my mom to come home from her 12-hour shifts. Every night, I would fall asleep to the thought of when my mom would actually rest. Starting at the age of 6, these thoughts and questions dawned on to me day in and day out. Being an undocumented immigrant from Guatemala, my mother worked these long, grueling shifts, not because she wanted to, but because we needed to have at least our basic needs met. And being the eldest child, I had to step up and help her as much as I could. Growing up in Ann Arbor, I always tried my best to being that perfect, normal kid that would be a part of as many extracurricular activities and get straight A's in all of her classes. But something that the adults in my life that didn't, like the counselors, teachers, coaches, not know about me is I had so many more responsibilities in my life that I had to take care of. Having to come home after study sessions, games, practices to take care and watch my little sister, having to be an interpreter for my mom when it came to doctor's appointments, teacher conferences, having to forge my mom's signature because she came back home from work too late, having the discipline to ignore the long stares from individuals when me and my family spoke Spanish out in public. You see, there's something called invisible identities that youth have when looked upon by adults. And these invisible identities are basically our very own unique, different stories. Now, the question that remains is, how can we truly understand invisible identities in youth?
Thank you for sharing that awesome story. It's really exciting for us to be here. This story about invisible identities probably resonates with a lot of you guys, especially if you work with youth. We're here to talk about my voice. The goal of my, Dave, that's assigned to you. They're saying louder, please. The goal to bring out these invisible identities so that we can understand what youth think, what youth need, what youth want, so that we can create programs that actually meet those needs. How many people here would say that the laws, the policies, and the programs right now are serving youth? That's why My Voice exists. So, really excited to get started to tell you My Voice is an interactive text messaging poll that empowers young people aged 14 to 24 to voice their opinions on important issues. And I think it's really important to talk about this text message component of My Voice, because that's how we bring out the invisible identities and give people an opportunity to share what's going on with them. So there's a couple things about text messaging that's really, really important. Number one, there's a lot of people, young people, who aren't going to be able to come to a conference like this, who aren't going to come to a focus group, join a study, join a youth advisory council. But those people maybe are the people, the young people that we need to hear the most from. And when we use text messaging, something that basically everyone has access to, it's the way that everybody communicates with each other in their everyday lives, especially young people, we're able to include those types of people. The other thing that's really important about text messaging is that it's asynchronous. In other words, people can get a text message, and then they can think about what they want to say, and then text back at a time that works for them. And what we found in the My Voice team is that when we interview youth and talk to them, which I'm sure a lot of you guys here do all the time is talk to youth, and then ask them the same questions via text message, we actually get to the same findings, is that they're sharing the same things, except when we do interviews face-to-face and in person, we end up making people feel sometimes a little uncomfortable, right? Like young people maybe don't want to talk about things face-to-face with you. Sometimes it's hard for them to collect their thoughts and get down to like the nugget of information that might be useful. Whereas in text messaging, which is their natural language, they're able to process the question, consider it, and then in their own pace, in their own way, answer the questions. We find that to be really, really valuable. So the history of my voice, there's no way we can talk about where my voice came from and where my voice is going without talking about my very good friend Zachary Rowe and the Parkside community. So is there anybody here from Detroit? Awesome. Does anybody know the Parkside community? Anybody? It's a housing complex near here, and Zachary Rowe runs a community organization called Friends of Parkside. And so about 4 years ago, I was at Parkside working with Zachary and telling him some of my ideas. I said to him, I think that there's things going on in this community, with young people especially, that we just don't know about. Like, how can we get to them? How can we talk to them? They're not going to come here, right? They're not going to like drive over. They're not going to send their kids. And he said, you know what? I have an idea. And he said, for years, Friends of Parkside would have these food giveaways, health fairs, school fairs, and what he would do is ask the young people at Parkside to take these flyers and go door to door and pass them out to the people in the community. And because kids are really smart, and it's the dead of winter in December, and they're like, we're not doing that. And they're the ones, the young people were like, I'm just gonna start taking these people's cell phone numbers, and I'll text you when the fair is, right? I'll text you when the food giveaway is. And that's how it all started. He's like, you know what, Tammy, why don't you use this text messaging group that we use all the time to communicate with our community and ask them questions that way? And voila, My Voice was born. At My Voice, we have a motto, our goal, and it's to give the right people the right information at the right time. And this is super important because I'm not sure how many people here do research, but the pace of research and the pace of what policymakers, people who run programs are working on are completely different, right? The example is a policymaker will call me and be like, Dr. Chang, I have a question about youth, and I want your opinion about what we should do about youth and what they think about this and what they think about that. And I'll be like, wow, that's a great question. Okay, let me write a grant on that, and I'm gonna collect some data. I got an IRB thing, and so I'll have an answer to you in maybe like a year, right? And he's like, whoa, no, I've got to vote on this on Thursday. And so there's this mismatch, and it doesn't need to be that way. There's technologies that exist that we use every day, right? Text messaging that we can use to collect information in real time. And so our job now is with this information to disseminate it to people who need it to make decisions that will actually help youth live better lives. We incorporate youth in every step of our process, everything from developing the text message polls, to working with stakeholders, to disseminating knowledge, not just amongst researchers and people making policy changes, but to everyday people, so that we can improve the policies and practices that affect young people. So a lot of people will say, all right, so you're a huge survey, lots of people via text message, how do you get these young people? And so I always like to just talk a little bit about how we recruit our young people. The majority of our youth are recruited through Facebook and Instagram ads. They're targeted to meet benchmarks based on the American Community Survey, which is a yearly census of Americans. And so we know what percentage of people 14 to 24 are Asian American, live in the Midwest, are female. And so we've been able to collect a huge group of people that we think includes a group of people who are typically invisible, at least to research. And then what we do is we funnel them to our study website, where they give us a ton of demographic information. Then everything else is in text messaging. They get 3 to 5 questions every week about lots of topics. We'll hear a little bit more about that in a minute. And they also get incentives. They get gift cards sent to their cell phones, $1 a week for answering questions. But if they answer 12 weeks in a row, they get a $3 bonus, which is surprisingly one of the main reasons why youth say they do the survey. So our youth actually represent people from almost every state in America. 1/3 of our sample qualifies for free or reduced lunch. 6% are non-binary gender. We have huge diversity in race and ethnicity. We're really proud to be able to give a voice to youth all across the country, from rural to urban, and use their voice to change policies. So, Dr. Chang, you just said you're gonna get 1,000 youth and you have 3 to 5 questions every week. Yes, that is a mountain, a literal mountain of data. a mountain of data. And we have a huge team to help us out. But what we do is use mixed methods, research techniques, where we take the quantitative data and with qualitative data, and we use both of that kind of information to help us understand. Because it's so much, we also use natural language processing, which is like computer algorithms, because sometimes when people are coding data, our biases might leak in. We might find or see things that pop out a little bit more just because of our own backgrounds, and the computers help us to avoid that. I talked a little bit about our team. We can't fit everybody on one screen, so this is just everybody that would allow us to get pictures up here. We have experts in mixed methods, experts in sampling, experts in adolescent health, some in this room, lots and lots of learners, young people, youth, and it's this kind of huge team that allows us to be really successful in what we do.
So one question that we get asked a lot is, what kind of topics do we discuss with My Voice recipients, My Voice youth? And it's pretty simple. Out of the 200 topics that we have, it's all topics that affect youth somehow and that are important to youth. So we have topics that run from sex education, opioids, to gun control, to gun laws, to politics. I mean, you name it, we have it. Another question we get asked pretty often is, how is the setup when we actually do text My Voice recipients? And it starts off with just a welcoming back message or hello, like any conversation would go on text message. And it goes back and forth with a conversational kind of tone. And specifically with this example, it's talking about how does youth utilize the healthcare system. And as you can see, we can gather so much more in-depth information with just these couple of texts. And you can just imagine by all the hundreds of youth responding to these texts, we can gain so much more than what we're used to seeing. So in this slide, it's all the different organizations and universities My Voice has partnered with. And in this slide, it is all of the academic organizations and conferences My Voice has presented at.
So My Voice actually has presented at a lot more places than this, but we wanted to give an example of the many different ways that we disseminate, right? So we disseminate in academic channels, so in places like these meetings where people like you might have already been to. Unfortunately, a lot of everyday people don't go to meetings like this, and so we do a lot of dissemination with media. We do a lot of dissemination in person, in communications with policymakers. We do white papers, we do policy briefs, you name it. If you need an infographic, that's what we do. That's the key about what I think we do, which is really different than I think traditional research, and we're really excited to talk to you guys about it because we do whatever it takes to elevate the youth voice to help in a policy conversation. So, one example was last year we asked My Voice youth about guns and gun control. And I love using this example because it's an example of how youth have thoughts and opinions are really nuanced. So if you were to think about how the media portrays how youth feel about guns, the protests and how there's a lot of gun violence that predominantly affects youth, you might think that youth hate guns, that they don't want people to have guns. But actually, our survey found that most youth think that guns are fine. I have guns, my family has guns, I grew up with guns, I don't care if other people have guns. What they told us in their open-ended responses was they're not against guns, they're against getting shot, right? Like they just don't want to get shot. And so the nuance of this is that most think that gun control would be really helpful. Not that they're against guns, but there needs to be some way to protect themselves. And of the people, the youth, that said, no, I don't think gun control, I'm not for gun control, it wasn't because they think everybody should have guns, right? It was because they were like, no, gun control isn't enough. Gun control isn't enough because then the good people won't be able to get guns, but the bad people will still have ability to get guns. And I think that it's really hard for everyday people to just think, wow, youth have these really, really complex feelings and that they're not really fighting against or the enemy in a lot of issues. And again, the example of trying to take this discussion that we have at our work, at the conference room table, and transferring that to the kitchen table where that everybody can understand how youth feels. We also have opportunities to inform legislation, House bills, on things that affect young people. In this particular instance, there was a piece of legislation that was trying to understand whether or not youth, there should be banning of harmful diet pills and muscle-building supplements for youth. And they wanted to know how young people felt about it. So how do you think young people felt? They were like, yes, please ban them if they're harmful, right? Like you would think like young people might say, no, we should have the right to blah, blah, blah. No, they were like, 70% were like, no, please, yes, if it's bad for us, please ban them until we're a certain age. I mean, I think you would not, there are certain things that you assume about youth that you wouldn't know until you asked. We also have the opportunity to elevate youth voice in large-scale policy reports, and this is one of the examples from the National Academy. And so I just want to transition now to talk about some of our findings related to reproductive health. And so these are going to be a few topics that we've asked recently, and we're going to give some big picture views and some example quotes. Anybody who knows me knows that I have been on a recent obsessive rampage about oral sex. Very, very concerning to me, and I'm very, very excited to talk to you all about it because, you know, my colleagues in head and neck cancer and experts around the country predict that by 2020, HPV-related head and neck cancer will surpass the prevalence of HPV-related cervical cancer. Yes, yes. And this is a clinical story that might help this make sense. So, you know, you have a person come into your office and they say to me, this young woman, and she'll say, you know, I use condoms 100% of the time. And I'll say, that's great, you know, but we still need to test you. You know, the right thing to do is say, what kind of sex, vaginal, anal, oral, and she'll say, you know, vaginal and oral. And what we've been doing more and more often, and hopefully all of you, is that we'll swab every orifice where there's sexual contact. And what we found is that youth feel like they're doing the right thing when they use condoms 100% of the time. So if I were to just test the urine of this woman, she would be negative for gonorrhea and chlamydia, right? But if I swab her throat, which I've been seeing more and more, we've been seeing so much oral chlamydia and gonorrhea. So is there anybody out here who has had this exact same experience? Lots of oral gonorrhea? Yes, and it's because young people, we don't know what their thoughts are about the risk of HPV, STIs, and oral sex. So we wanted to know, what might help more people use protection during oral sex? One last statistic. National surveys say, so we want to know how many people even use, I mean, maybe everyone's using condoms and I'm just like totally out of it, right? So, you know, there are national surveys that ask, and less than 8% of young people use any type of protection. All right, so what did they say? So what might help young people use protection during oral sex? Some youth said more education about the risks of oral sex, like they don't know. People usually only think of penetration as risky. One person said, I don't think anything could help, as using protection for oral sex is a bizarre concept towards most people. And I think that's so important for us, right? Like when we create a program for something that is just education, we just have to tell them and they'll know what to do, that's one thing. But when they think it's bizarre and it's not gonna happen, the program needs to look completely different, right? I don't think they should get tested and trust your partners, right? They're saying, I don't think people should use protection, get tested. That's great for things that we test regularly for, right? But that doesn't really solve the HPV problem that we're talking about. So big picture, youth don't know the risks of oral sex, and addressing education and stigma is going to be really important. Okay, next example, physical intimacy in youth. My second obsession. You know, physical intimacy, we define that as everything from holding hands, to hugging, to kissing, to touching, to sex, right? And, you know, I think there's a hyper focus on sex education. My recent 5th grader just went through his first sexual education, and I love the worksheets that he came home with, right? These are worksheets where he colored in fallopian tubes, right? Labeled the vas deferens. There was a little matching sheet about what happens if I smell bad, and he had to write like a proposed solution, which he wrote as take a shower, right? Like that's what people are getting in terms of physical intimacy, sex ed. And we were like, wow, is that really what we're talking about here? How do youth really want to learn about this? So we asked. So when we proposed this question, they said more explanation of all the romantic stuff in a way that makes sense. right? The romantic stuff in a way that makes sense, which makes me feel like maybe we're talking about it in a way that is not making sense to youth. That we're only giving them one option in 5th grade, which is when you have puberty, you're gonna have these urges, use a condom, which I'm not sure is what we're actually talking about, right? So, some people said the same time as sex ed so that I and my peers have a better understanding of sex and the fact that sex is not only for production and can be fun and loving between 2 partners. So separating this idea of sex ed and intimacy. And I wish things were taught outside of a clinical, academic, and a sex-focused context. Another person said, I wish it was taught to me at school with a test on it and all that jazz. And I highlighted jazz because I thought that was so cool when they said jazz. I wish I didn't have to figure it out by myself and it wasn't a taboo topic to parents and teachers, right? They're wishing that they could talk about physical intimacy with the people that they trust. And I wish that my mom had sat me down to talk about the basics of it as a kid and then talk to me more in depth once I reached 12 or 13. And most youth said they really thought by puberty, 12 or 13, that they should have been talked to about physical intimacy, not just sex. So big takeaways. Youth want schools, parents, and trusted individuals to talk to them early about intimacy, not just about sex, about intimacy. And youth wish that they would have learned about sex in the context of intimacy and relationships.
So next topic, sexting in youth. And the statistic I will give you guys off the bat is 95% of youth believe that sexting is prevalent, very prevalent. So my voice wanted to know, since it's so prevalent, when does it actually make youth uncomfortable receiving these semi-naked or naked photos? So we asked, when would receiving a naked or semi-naked photo make you uncomfortable? Someone said, anytime I don't want to see someone's junk on my phone. Anytime because I don't want that on my phone just in case it gets leaked. So this person is saying they're uncomfortable with it, but with the fact that if someone else were to retrieve that photo, they don't want the other person being put in that position. When it's unsolicited, because I didn't ask for or consent to seeing it, so this person just felt, of course, violated. Pretty much any time. There's really no use for naked or semi-naked photos for any decent or legitimate reason. Spontaneous dick pics, especially from adults. Basically anything that's unwarranted. It's gross, creepy, and illegal. Right. So we know that sexting is prevalent, and we know now that you feel uncomfortable. So as policymakers and creating programs, how can we protect youth when it comes to them receiving these photos, these unsolicited photos when they did not consent to seeing it? Which leads me to my next topic, which is consent in youth. So with the lack of conversation we've had about consent, sadly, rape, sexual assault, sexual harassment, altercations have increased, and we want to know from youth, how would you define consent in a physical or sexual encounter? One person said, not doing anything that is unwanted. Someone said, people are not realistically going to ask a person, do you consent to have sex with me, or something of that sort before doing so. Verbal consent, when both people are sober and able to do so. The person said, I don't know. Another person said, a clear, enthusiastic yes to every activity individually, step by step, with the ability to consent at any point, which is not obtained through coercion or physical force. Okay. So as you can see, the meaning of consent is varied when it comes to youth. And since we know that now, how can we create programs to help youth better understand consent?
Our last topic, birth control. It's a favorite. I know a lot of you probably love it too. Birth control is something we talk about every day in my clinic, anytime I see patients. And Sometimes when you talk about something a lot, you get this assumption that there's this thing called the internet, and my patients probably have Googled it, and they've asked all the questions that they have, and they know, I mean, it's so easy, bedsider, and all these things, that they probably have access to all the information, maybe even information in a youth-centered way, but we weren't sure. So we asked, what questions do you have about birth control? And so one person said, I wondered about how it will affect my health, and will there be negative side effects, right? Bread and butter stuff. I had no idea there was more than pills. Why is it taboo to talk about? Is there male birth control? I got really excited about this one. I told my husband, I was like, oh my gosh, there is. I can send the prescription. It can be sent to them in the mail. And my husband was like, I don't think that's what they meant. I think they meant M-A-L-E, male. But I was like, okay, that's great too. That's great. That's a good question too. Why do people want it banned, right? These are the questions that are coming into youth's minds when we say, what do you want to know about birth control? Why do different ones work for different people? Why isn't it free? Why don't people like it? I was just wondering if there were any other benefits of using birth control. How it works, what methods are most effective. And honestly, that last one and the first one are really, really common ones. We're talking about bread and butter birth control stuff, right? And so I know I've adjusted my own practice where I have to stop assuming that young people who are on their phone all the time, I mean, they're on the phone as I'm talking to them in the clinic, right? They're probably looking up no, they're not looking up birth control, right? They're not looking at birth control. And that it takes time to explain, to give them opportunities to ask. And hopefully, what we can do is alter the way that we think about youth and the internet and information explosion and make sure that we're still doing a really good job with youth. The other thing that I think was so interesting was that large proportion of youth who didn't just ask about the mechanics of birth control, but asked about the politics of birth control, right? And I think that's really exciting to be able to involve youth because they care, they want to know, and that we should help them understand it.
So as you all know by now, I had a summer internship with My Voice, and I was able to work with the Washtenaw County Health Department and the Corner Health Center to create pop-up events throughout IPSI. And what I will say is actually getting to speak to youth one-on-one, face-to-face, was the greatest experience that I can say I had, because I mean, they were just sharing their experiences, their stories with me firsthand, and it was truly an honor. And it reminded me of something that I always told myself is, you will never know a person's story unless you ask. And I hope by the end of our presentation today, you all have learned that we are capable of learning about, we're capable of retrieving youth voice and youth opinions on topics that affect youth. And if we're able to do that, we will all make youth lives better. So, thank you. Any questions for us?
So there's a few microphones, or one microphone? One microphone. Is it okay if you have questions, or two microphones? One in the back, perfect. Just pop on up so we can hear you and everyone can hear you. Check out our website.
This is on? There are, wow. As we know, there are clinical guidelines surrounding GC and chlamydia testing for all sexually active, individuals. So when you were talking about swabbing all of the orifices, are there guidelines now surrounding, for youth, for example, predominantly they are having oral sex. So when they come in and we're counseling them, do we automatically swab them? Is that part of a guideline, number one? And number two, do you use the same swab that you would use for a cervical swab? Because most of the time we're doing urines on them now.
It's the same as a vaginal swab, says the real expert. And I love guidelines. I'm going to tell you right now. I love guidelines. They really help, especially when you're not really sure if you're doing all the right things. But one of the things, as I talk to more and more hundreds and thousands of youth, I realize that the guidelines aren't really made for individuals, right? They're made for the masses. And so when you say, is it in the guidelines? I actually think it is. The guidelines change all the time, but if you were to ask me, should you do it? I would say absolutely. We are in an unprecedented time for STIs right now, right? The highest recorded levels of gonorrhea and chlamydia. And of the people who have gonorrhea and chlamydia, what is the largest group? Young people, right? And so if we've got all these young people who are very educated, using condoms 100% of the time, but still actively having oral sex, right? And not knowing that that also puts them at risk, we find ourselves in a very, very, to me, exciting opportunity to help youth be healthy in a way that they're not really sure about. It's not on the internet, right? It's not necessarily maybe in the guidelines, but we should be doing it, we should be educating on it.
And part two to that question, is there a way to swab for HPV? To my knowledge, there is not, but.
There is a way to swab for HPV. I've never swabbed the throat for HPV.
Yeah,
I'm not sure it's going to be really helpful. My HPV message is this. Actually, who can guess what my HPV message is? Vaccinate, yes! Vaccinate. You know, we don't know the impact because right now we're kind of in this bridge generation where we just had this generation of youth that are like, what is it, like a little bit, about almost 50% vaccinated, right? And then we have this whole generation that isn't vaccinated. And so that's the generation that's going to be really affected right now. Oral sex, lots of exposure, right? This next generation, who knows? Hopefully it won't even be an issue, but I wouldn't bank on it.
Hi, I was just curious if you could go into more detail about your pop-ups that you were just talking about, kind of describe what happened, how did you set them up, and also, was it similar to the texting, and then how did you record that information that you received? Thank you.
Okay. Every Monday we would be on the phone, like a big group call, and at first we had the idea of creating mobile van units, going out to Ypsilanti communities, having like nurses, social workers available to the community at first hand. So we created 3 pop-up events, and the one I was talking about was the first one, which was the neighborhood, was it? Yeah. And we just recorded, we asked them questions surrounding how are you feeling when it comes to school, like have you ever had these thoughts? Do you think that these mobile van units would help? What is the reason why? Is it transportation that's giving you lack of transportation going to the doctor's office to receiving this kind of care? If so, like things like that. And we recorded on a piece of paper, and that's when they disseminated it, and we went through from there. And that's when sadly my internship ended. It was pretty quick. It went by really fast, to be honest with you, but.
Pop-up events were very, very successful, and I have to say it was like 97% tomorrow. The reason, I know, she's amazing. And so one of the reasons why we even had these Monday calls, right, like why were we meeting, why were we talking, is this explosion of successful suicide attempts in Washtenaw County. Right? There's a crisis in the county where we work and live, and Washtenaw County Health Department, Community Mental Health, Cornell Health Center, lots of different organizations came together, my voice, to say we need to know what is going on with youth. Whatever we're doing right now is not working, right? Just another one last week. We are in a crisis mode. And so, we had all these different ideas. What do we do? What do we do? What do we ask? And one of the things that we came up with is that we need to be out in the community, talking to people, asking them what they need, and that's a huge part of what My Voice does, right? So that's what Tamara's saying. She's out there, she's talking one-on-one with people, asking them, what would help you have access to mental health services? What are the things stressing you out? What's going on in your life right now? And collecting that kind of like on a clipboard, and talking to like lots and lots of youth. I mean, have you ever worked at one of these tables? Like literally there's a table, and it's like everybody sees a table and they're like, no one wants to talk to you. No one wants to talk to you. And that's one of the reasons why text messaging is better. But what Tamara would do is she'd be like, we're at football games, we're in the community, and she's like, I'm gonna go up in the stands. I'm gonna go up there, I'm just gonna like go up and down and just talk to people, right? Like I'm gonna go out to the jump house, right? I'm gonna go to the food line and start to talk to people and actually understand what's going on with them. So we did these little pop-ups, so it wasn't like this permanent thing, right? It's data collection, trying to understand what's happening because we were in a crisis situation. And they loved it. We also gave out some school supplies.
Yeah.
And, sometimes
yogurt parfait.
Yogurt parfait. Never buy plain yogurt. If you leave here with any information, never buy plain yogurt. They think it tastes like cheese.
Yeah.
Vanilla yogurt for the kids. Okay.
Yeah.
Good question.
Question for you, and it really deals with, first off, phenomenal app. I love it, so bravo to you all, because you're really making a difference in the lives of our young people. So my question is, especially when we think about our young people and sharing, especially through text messages, when you get your responses, how do you all deal with text messages that have disclosures? And then how do you connect those young people with the resources because you're not there with them?
This is such a great question, and it gets really into the weeds of My Voice. I mean, there's a lot of details. Number one, My Voice has it's called an NIH Certificate of Confidentiality. It means that anything that's said through the My Voice platform can't be used to incriminate a participant legally, and we take that really seriously, number one. Number two, if somebody were to say something alarming or I need help, and we see it, we would connect them with resources. However, that is not the goal of My Voice. When they consent to sign up on that website, we make it very clear, big, bold letters. A human may not read this for a long time because we use a thing called natural language processing, right? Like we're putting this through a huge computer algorithm that's helping us to pull out like the main ideas. And so they know to not ask for help through this. We have a study phone line, a website, web forms. They can contact us in other ways. Now, does it stop people from saying sometimes like things that you would, if you heard in person, would do something about? No, they're saying stuff like that all the time. But they know that there's no way for us to be able to catch it in real time. And that's just the fact of the matter. The other thing about My Voice that I think is really important to mention is that we are a mixed methods qualitative study. So our goal isn't to figure out, for example, how many youth are having oral sex, or do you jewel, and have you tried pot? And lots of other surveys do that. We don't do that. We are trying to get at the how, the why, the stories around those issues, because honestly, that's what people need, right, to change policies. They don't need to know, 4% do this, 3% do that. Other people are doing that, right? We're talking about the stories around these issues so that policymakers can use the story. So, another big motto of ours is that in My Voice, no data without stories, no stories without data. Thank you.
No, thank you.
Hi, thank you for your work and your presentation. Can you share a little bit more about how you use the data that you collect to mobilize policymakers, and how do you just talk a little bit about your strategies for connecting this work with people making legislation?
Yeah, that's actually a really big black box. Ask anybody in research. How does your research change policy? Right? Isn't that one of the points of doing research, so that I don't just take care of patients one-on-one, that I'm having this group effect, right? And I would love to hear what they have to say, because I think that it's really, really tricky to do. I'll tell you what we try to do. Number one, we try to work directly with the policymaker when they have the question, right? So they are passionate about adolescence in some way. We seek them out. We ask them, what do you need to know? What are you working on? What can we do to help inform your work, right? That only works some of the time. Because unfortunately in America, politics doesn't really work like that, right? They're not like, I'm gonna make youth health better. A lot of times it's more like, these people are complaining a lot and I need to do something about it, or there's a crisis and I need to. And so we are watching and listening and following the news cycle and being really connected in the community through all our collaborators so that we can know what kinds of things are coming down the pike and we can prepare questions to inform policymakers. The other things the examples that we had shown, like the National Academy of Medicine, right? Like these are the bodies that are commissioned by Congress to answer big questions about adolescence. And they work with us so that we can insert youth voice into those reports, right? Give them the stories that will help them be successful in stating legislation. And so those are some of the ways. Now, are we always successful? Oh, there's more. Of course we work with media. One of the things that I'm the most passionate about is letting everyday people know what's happening. Right? Everyday people are the most powerful. The policymakers aren't that powerful. Everyday people are the ones who need to go to people and say, no, this has got to happen. My kid, that's what needs to happen. And they can't say that if they don't know what's happening. So we work a lot with media and dissemination and public relations. Now, the thing I was going to mention is that because we're so passionate about this journey from finishing research, writing the paper, and actually making policy change, we're working with this amazing design student who has a background in public policy, Catherine Jones. She's amazing. You should Google her. She's also going to be highlighted on our website. And she's used her design thinking to break down this process between, okay, you published a paper or you thought of an idea and how to make a policy change. And that is going to be one of the first times ever that I've ever seen that process kind of laid out. And we hope that can be a blueprint for lots of different researchers to say, you know, the story doesn't end with you publishing a paper, right? No offense, no one's going to read that paper, right? Like, how do we not waste government dollars, everybody's taxpayers' money, and to actually make things better for people that we know, love, and care about? Good question. I think we had a question over here. Yeah, come on over, get a mic.
Hello, thank you. I don't know if you know who I am. You probably do. I've seen you at the Corner Health Center.
You helped me at the Corner Health Center.
And I actually sit on the board of directors at the Corner Health Center now, which is pretty cool. Thank you. What I wanted to say was, I am very involved in the Ypsilanti community, especially. Excuse me. And I was not able to learn much about my voice until I came to Ann Arbor Spaces to do advocacy work. And in these spaces, and one of them is TAC, everyone else knew about it and they came from different communities. And being in my community, I know that a lot of young people don't really know about the specific service of my voice in the text messaging thing. And I think what I realized is a lot of times when it comes to the Ypsilanti specifically, we're more like clients versus being a part of the organizing of it all. And I wish that there were more, I don't know, actions to make sure that my people are able to be a part of planning, because when you do that, it brings so much cultivation to a community, and our families would thrive so much more. And I guess there's one thing I'm going to say before I actually ask my question. I'm sorry, I don't know how to do it.
No, it's all good.
When you said, and correct me if I'm wrong, did you say it's 12 weeks before you get a $3 bonus?
Yes.
I know that specifically in my community, young people, and especially when I was in high school, 12 weeks is 3 months. I know kids who every single month their phone is turned off for like a week or so before they get enough to actually pay for something. And so just that right there takes them out of the privilege of being able to have that done for them. And then also, I just want to know, what are your actions to really including underprivileged youth, like the people in my community?
All excellent questions. All excellent questions. Tamara, are you thinking of anything, or you're just like, yes, you agree?
Well, I can definitely say that I didn't know about my voice until my Rising Scholar teacher at Skyline told me, like, Tamara, like, you should apply. And I'm like, no, like, do you really think I'm gonna get that spot? Like, seriously? But I did, and yeah, and I've realized that as well. And I really wish I can say that I was able to, maybe I can, speak to the counselors and have them understand that these kids that they're speaking to every day, I know they don't feel as though they can trust them in that kind of way. Maybe we can create something better for those students and those counselors to have that kind of more of a relationship, rather than like, okay, like, am I ready to graduate? Do I have my credits in? Thank you, bye. So that's all I can say, but.
I thank you. And we worked really, really hard to incorporate as many people, especially from IPSI. Everything you said is true and right. Everything you said is true and right, and we're working on it. We're working on it. You know, there is no easy answer. I think the fact that these are all things that we're working in progress to make better is true. I'm really excited to say that. One of the main reasons people will ask us questions on our study line is they're like, and it only happens about 1.2% of the time. So of 1,000 people, it's actually not that many. They'll say, my phone number's gonna change. Can you change it for blah, blah, blah? So yes, those people aren't necessarily gonna get the $3 bonus, although I have to say we're very liberal with the $3 bonus. They might not get the $3 bonus, right? Because they're gonna miss a couple weeks or whatever. But I love the fact that they come to us and they say, this is gonna happen. People have said, you know, I feel like I'm in charge of this thing, and I'm really glad that that's the case, but there's nothing we can do but to keep working harder. Now, we are in Detroit, we are in Southeast Michigan, and when I showed that map, you see all those bubbles in Southeast Michigan, because we're super oversampled in Southeast Michigan. If anything, when I talk about this nationally, like every other month, people are like, you know what, it sounds like Michigan's real connected, right? Like Michigan gets all my voice. And so it's funny that you're like, we need to be even more local, where other people think that we're too local. We think being local, we have learned that being local is the most important thing, right? National policymakers, I hope this is not recorded. National policymakers, you know, they've got a lot of stuff going on. They've got a lot of stuff going on, and they may not necessarily be interested in what we're talking about. Local policymakers, they are our best friends. They're like, please tell us more. How can we make this better for youth every day? And we want you, we want all the people in Ypsi and in Ann Arbor. All the Ypsi high school counselors have heard about our internship. All the Ann Arbor, unfortunately there's so many Ann Arbor high school. All the Ann Arbor high school counselors know about this. We're really excited to involve anybody who's interested. So thank you.
Hi, I am a public health nurse in Southeast Michigan, and mainly my population is, for those of you from Southeast Michigan, is Children's Village in Oakland County. And my question is, I've never heard of a program like this, and I think it's awesome. But the kids in Children's Village are not allowed to have their phones. So I love the idea of the pop-ups and like you're just going to people at the football game or whatever and talking to them. Is that anything that you would be able to do? I know there's safety procedures and things like that you have to go through to go into a facility like Children's Village. But to be able for those kids to talk and be asked, what can we do? Talk about stories. They've got stories. And for them to feel like someone wants my opinion, like what could change this, would be beyond awesome. And I didn't know if you guys go into anywhere like that.
I agree with you on that. Sadly, I am not an intern anymore. I know the pop-ups are continuing, still CC'd onto the email list. They changed the name as well, so I'm sorry, I wish I could help you so much more. Maybe I can get your contact information and get you contact with someone else that could help you and guide you with possibly having that available for your school.
Thank you.
Yeah.
Of event, right? It's totally possible for your own just to say, I'm here, we're here to listen. We used to call them listening parties, where we just like about food, about music, but like fun stuff, and we're here to just tell us what's going on. And you could do that in your own institution for your own purposes, right? You were gonna.
I was just gonna say, the only reason I would veer away from that, if at all, is because there's so much bureaucracy in the county that I'm almost wondering if an outside agency that's established with a program would be able to get through a little more effectively. But it is a good idea, and I will bring it up to somebody. I have no problem with that, which is usually my problem.
Yeah,
But-
and so this might, I think that might be a great way for us to work together then.
Yep.
Yes.
So I have a two-part question. My first question is this, I may have missed this earlier in the conversation, is this data only collected in Michigan, or is this a nationwide, so it's nationwide? And do y'all have state-specific data available if we wanted it, like for the state of Georgia?
Yes, we would, but you know how I was just kind of going off a little bit about how local is most important? Right? We haven't oversampled in Georgia. We could, right? We could. Like, for example, next week we're going to meet with the city of Chicago in Northwestern University because they want to have basically like a My Voice, but for Chicago, because they want to hear what's happening in the inner city. And so they're flying us out so that we can help them to kind of work through some of the details, a lot which we didn't talk about today. But in Georgia, we've got tons of people from Georgia. Now, would it be enough for you to feel like this is, I can do a lot with this? Probably not. Probably not. But does that mean that we couldn't oversample in Georgia, or at least help you to create a platform? Absolutely. There's nothing fancy about what we do. When we say we just text them, right? There's nothing, we try to show you everything. There's like nothing hard about what we do. It's not expensive. It's just that nobody has done it yet, and we want to help as many people as possible do it more. So, Georgia, talk to me afterwards.
Thank you.
You got it. For inviting us. Thank you so much for coming on.